This week's Ask Dr. Durie comes from a patient who is obviously interested in science and has been watching the news. The question is, has there been an interest in CRISPR technology in the United States? And the answer to this is absolutely yes. But the next part to the answer to this question is, well, what is CRISPR technology? And this is a type of technology which I have discussed a time or two, and which is a type of very sophisticated gene editing that can be used to change the genes in living cells. And the reason the questioner is asking about the United States is that a lot of the early research has in fact been conducted in China. And in the news very recently was some very controversial research where gene editing was done in the embryo of a baby, and the baby went on to be born. And this type of genetic manipulation in babies is a type of research which is really frowned upon right now at the early stage of this type of technology. And in fact, in China, the research has already been outlawed, and this team is not able to continue with this type of research. However, this is very, very powerful technology, and with the appropriate ethical safeguards and further work, will undoubtedly lead to many, many future breakthroughs. And to specifically answer the questioner's idea, the research is definitely being conducted in the United States, and many labs are focused on this. And for example, at Berkeley University, some of the early work was done in the area of CRISPR technology, as well as the Institute in Boston. And so the research is ongoing. In the area of myeloma, there is not so much research focused right now, but it is predominantly in the lab to study whether, for example, if an abnormal gene is edited out, this could reduce the potential for the myeloma cells to grow. From this type of research, we can understand if genetic editing could have a place in future therapies. To be applied in myeloma would, however, be challenging because there are many genetic mutations in patients at the time when the disease is in its active phase. It's not like in genetic diseases where the technology will be applied first. For example, in children with sickle cell anemia, removing the gene responsible for the sickle cells, a single gene, will definitely be achievable and will become a form of therapy for this disease. The application in myeloma will be possible if we can approach the disease at an early point when there are maybe just one or two mutations that could potentially be edited out. The bottom line for this particular patient, number one, yes, research is going on in the United States. This research is in the lab, studying the very early stages of the impact of gene editing. This is extremely exciting and will be undoubtedly very important in the future, but it's going to become available some years from now. So something for the future, something to be watching, and something to be aware of as a major approach down the road.